tarmacked, and you're wondering, what business can I venture into with my knowledge in medical field? You don't have to be employed with these hard times if you've tarmacked and there is no job. Self-employment is very, very key. As a medic practitioners, never get worried. Never get worried. There are fields that are well paying when you open up a business in those lines. Today, it's your girl Kagena Ondega bringing more light on you being a medic and you want to open a business which is the best and which can bring more income to me as a practitioner or as someone who's tired of what you practice, or you do not have that job and you feel you can work in the line that you studied. Don't forget to like, share, subscribe to this YouTube channel that brings more light when it comes to medical equipment, which is the best to use at home, which is the best to use in the healthcare facility, which is the best, where do we get them, and all that revolves about medical equipment. So our first very, very passionate business, I would say, is the medical equipment business, medical equipment supply business. It is wide, it is broad. You can decide to venture into a specific line of the medical equipment. For example, you can take surgicals. The wide range of surgical instruments, surgical equipment, you can decide, I'll be importing surgicals, and that is all what I'll be dealing with. Because they're wide range, so you can bring tons and tons of this equipment, and they're used on a daily basis in theaters. For major surgeries, minor surgeries, all sort of surgicals are very, very key. So if you're interested and you want to go to a specific line, I just gave an example of surgicals because they're broad. You can also decide to settle on optical equipment. There are quite range number of them. You can bring or buy locally and decide, I am doing optical, I'll be known for the optical equipment alone and alone. You can go dental equipment, dental consumables. They are also lucrative, well paying, and you can settle on, you're known for dental and dental consumables alone. You can also believe in yourself and bring all the equipment that are used in a healthcare facility. That can be dental, optical, surgical, diagnostic, furniture that are used in the healthcare facility, theater, ICU, maternity equipment. You can bring them. You have a one-stop shop that has all of them at your doorstep, at your shop. This gives you a bigger market compared to someone who has one line of equipment, and it is, I would say, it opens more of your doors when it comes to bringing more income, because you have everything. If someone is opening up a hospital that is comprehensive, has inpatient, outpatient, laboratory, maternity, ICU, theater, you'll be able to equip that facility, you individually, compared with someone who has a surgicals. They will just sell the surgicals if they approach for the business. So having all of them under one roof, it is a plus to you. Another line that is very, I find it good and bringing money is the optical. Having an optical clinic, optical center, specific providing optical services. May they be minor surgery, major surgeries, spectacles, treatment, all that optical. I find it a good business, because if you're registered by medical insurances, they pay, be it with the private or the public ones. Another line is optical one. You have an optical hospital, the dental clinic, a dental hub, a dental place. It's also paying one, because insurances, they cover. So with that, you are in the line of dentistry and you like that, that's a plus. That will pay your bills, that will make you fulfilled, because you get back your money. after investing in dental units and their consumables and all that. Another venture that would be well paying to you is having home care based service. What do I mean by home care based service? Is where you have a firm that provide home care services. You can be the consultant providing home care services, meaning you have employees who will be taking care of the sick, the elderly, the critically sick, the chronically sick, who are being treated or being managed at the comfort of their homes. This is where there is a total complete setup, like a hospital in their comfort of home. Because maybe probably because of high bills in the healthcare facility, people opt to take their loved ones to their home where they get services that are equally the same as those in the hospitals. Majorly the nursing care services. If they need physician review, they are done at the comfort of their home, unless it is critically or they're critically ill, they need an attention in hospitals or maybe be rushed to an ICU. They can be taken care of at the comfort of their home. So you'll have your employees who will be handling this patient in their home, and it is well paying because the family will provide the equipment, the beds, the mattresses, oxygen supplies, function. Your work is to provide the services, giving medication, turning with the patient, provision of physiotherapy, occupational therapy. So it is you to be controlling. So you being as a consultant, you can have a big farm because there are many patients undergoing partaking this care in our country, and it will be well paying. The family will be paying you, and you will now be settling the bills with the employee working in various families. And I find it so fulfilling because you'll be solving people's emotions, because you're helping them not to have big bills in the facility, in the hospitals. You'll be the link between their finances, the emotions, with the sickness and their loved one. So you'll be a lifesaver to them, because their patient will get quality health services because you're there for them. You're there because you're in the home care services. I find it a very, very well paying and a good job if you're interested and you like it when it comes to service provision. Another one that is also well paying, if you're in diagnostic, you can have a diagnostic center where your work is to do the diagnosis, and people will be going for the reviews to their physicians or their specialists with the result that you've done. For example, have a diagnostic center that will be doing X-rays, MRIs, CT scan, ultrasounds of various regions, and it will be a killer because your work is to have the machines and have the expertise, the radiologists, sonographers to work for you. Or you are one, you can have maybe an ultrasound, your work is to do ultrasound of various regions. So people will be referring the clients to you, and your work is to do the diagnosis, the diagnostic test, and sending back to the results to their physician. But if you're in a position, you're a radiologist, you're able to interpret, you just interpret, and the patient takes the results to their respective doctors. So that is also a killer. It's not hospital per se. Your work is to diagnose because you've invested in the machines. So your work is to provide that service, but it's someone else to implement, to implement and follow what this diagnostic have given the results. So I find there are few, but there are few that have brought to people, but there are many. If you sit, do research, they are well paid. Those are top, which I find I can do, and they will bring back good pay if we concentrate and give the best in our country. Don't forget to like, subscribe, and share for more tips when it comes to medical field, medical equipment, medical business. We need to help each other as we overcome our challenges and as we grow each other. Don't forget to like, subscribe once again. It is your girl Kagendo Driga.